Hi, today I'd like to talk about premature ovarian failure. In this condition, a woman loses ovarian function before age of 40. And the commonly cited symptoms would be amenorrhea or when reduced in menstrual flow. Most of the time, premature ovarian failure can be caused by a genetic abnormality. So there are certain signs and symptoms that these women will come to us with. There are a few signs and symptoms where we look out for when these women come to us. In some cases of premature ovarian failure, the woman has an autoimmune disorder where the immune system goes against the ovarian cells. Others may be Turner syndrome or Fragile X syndrome, which is a genetic problem. But in some cases, unfortunately, we cannot determine the cause. In women who have had cancer treatment at a very young age, where they had to undergo chemotherapy, even radiotherapy, these things can also affect their normal ovarian function. Family history is another issue, where all the women in the family tend to attain menopause at the very earlier age. The other issues would be lifestyle problems, smoking. In women who smoke, generally the anti-Mullerian hormone or the ovarian reserves tend to be much reduced compared to their peers at a similar age. To diagnose this, there are a few things we can do. We can do blood tests, where we check the follicular stimulating hormone, or we can do the anti-Mullerian hormone. We can ascertain their ovarian reserve. Treatment for premature ovarian failure all depends on what you want to achieve. There are a few things you can do. Number one, depends on whether or not you have sufficient amount of eggs. If you do, then we'll give you a high dose of medication to retrieve the eggs and do the IVF treatment for you. Secondly, if you have insufficient eggs, then you have to undergo an egg donor cycle for it. Method of treatment would be some women tend to have symptoms of estrogen deficiency, which are like hot flushes, vasomotor symptoms, and these women, we give them hormone replacement therapy with the progesterone and estrogen hormones for them to reduce all these side effects. In summary, premature ovarian failure is something which we should detect and diagnose as soon as we can. Treatment depends on whether it is fertility or hormone replacement therapy. With fertility, we can assist the women to achieve a pregnancy. And hormone replacement therapy, we can help to ensure that their quality of life is better.